Hello my dear students, I am Dr. Vaishaly Bharambe. I have been teaching anatomy for last 25 years and I love it. Today we are going to talk about the Norma Verticalis. What does it mean? It means the skull as viewed from above. As you view the skull from above, this view is referred to as the Norma Verticalis. A question always is asked by students, ma'am, why should we study the normas? Don't we have enough to do? Yes, you have to study the normas because only that student who knows the bones well knows the head neck well. So study your skull well, study your mandible well, study the humble hyoid well. If you know your skull, you know your head neck. Take it from me, I've been doing this for 25 years. Even I understood head neck only after I did the skull in and out. Okay, so let's dive into the topic, students. Right, Norma Verticalis, the view of the skull as seen from above. Define the topic to yourself so that you know what you're getting into. Yes, I'm getting into Norma Verticalis, which is the view of the skull as I see from the top. Fine. Now, let's take a look at what are the bones that are forming the Norma Verticalis. Which bones come together to form this top of your head? Okay. So, let's take a look. In the front, there is the frontal bone. On the sides, there are two parietal bones. Posteriorly, there is one occipital bone. So, 4 bones contributing to formation of Norma Verticalis. But each of these bones is meeting at some joint. That joints are called as sutures. Okay, so let's find out how many sutures are formed. 4 bones are forming with sutures. Anteriorly here, you can see a coronal suture, which is between the frontal bone here and the 2 parietal bones. Then you will see the sagittal suture, which is between the 2 parietal bones. And then you will see the lambdoid suture, which is between the 2 parietal and 1 occipital bone. So how many sutures? Coronal suture, sagittal suture, lambdoid suture, 3 sutures. We'll now come to the general features of Norma Verticalis. When you look from above, what do you see? You see that the whole skull cap region, the whole skull cap, this is skull cap, okay? Normally we have the skull attached below, this is the skull cap. When you look at the skull cap, you see that it's quite narrow anteriorly and it's quite wide posteriorly, okay? This point where the frontal bone meets with the 2 parietal bones, this point is called as the Bregma. Okay. Similarly, you travel downwards along the sagittal suture, you come to a point where the 2 parietal bones and the occipital bones meet, or the sagittal suture and the lambdoid sutures meet. This point is called as the Lambda. So what are the new terms we understood? Bregma anteriorly, Lambda posteriorly. Okay. Now come back to the screen. You can see a parietal foramen here. Okay. So this parietal foramen allows for passage of emissary veins which connect the scalp veins to the superior sagittal sinus inside your skull. Okay. So you will wonder, what is the significance of this? Why are we learning this? This is important because this emissary vein is now acting as a channel, allowing infection from outside to enter inside the brain. So this is a very significant, important finding. Whenever there is infection of scalp, there is always a danger of infection descending down into the brain through the emissary veins. Today it is emissary vein through parietal foramen. You will find several other places where there are emissary veins in the skull connecting the outside to the inside. Okay. Right. This rounded cap of your skull is called as the skull vault, and the highest point of it, run your hand on your skull please. Can you feel the highest point? That is called as the vertex. Continue to run your hand back. You find there is a posterior projection on your skull. This posterior projection is called as the external occipital protuberance. So, now if you look at the skull here, you can see a projection. Run your hand on your own skull, please. Can you feel two projections here? These projections are called parietal eminence. Let's draw a line joining the two parietal eminences. This line indicates the maximum transverse diameter of the skull. I have a question for you. Which part of the brain lies beneath the parietal eminence? Beneath it lies the posterior ramus of lateral sulcus, the upturned end. Remember, the posterior ramus goes up and then turns up like this. That upturned end lies beneath the parietal eminence. That's where you have your Wernicke's area developing. Significance of parietal eminence is that it's one of the most commonly fractured parts of your skull. Okay? Right. Now, certainly on this, you see two more lines. Can you see two lines on right side, two lines on left side? Yes, these lines are called as temporal lines. What are they called? They are called as temporal lines. And the area they are delineating is called as the temporal fossa. Okay. So, this is the inferior temporal line, this is the superior temporal line, and they give attachment to something. Remember, on your skull, when you have any prominences or any lines formed, it's because something is attached to it. Okay. So, attached to the superior temporal line is your epicranial aponeurosis. Have you read the scalp? Yes, then you know epicranial aponeurosis. Attached to the inferior temporal line is a temporal fascia and the temporalis muscle. Now, students, this is a complete fossa being delineated by the inferior temporal line. In the fossa is attached your temporalis muscle. Around it is attached your temporal fascia. If you just clench for a minute, you can feel the muscle here. Keep your hand on the side of your skull and clench. Can you feel a muscle there? That's your temporal muscle. Okay. Right. So now we've done the general features of the Norma Verticalis. Let's talk a little bit about each of the sutures as well. So here we are seeing the coronal suture. Okay. So question is, classify the suture. This suture is classified as the serrate suture. Question is, what is a serrate suture? When the edges of the two articulating bones meet each other like the edges of a saw, okay, then it's called as a serrate suture. So, are there any other examples of serrate sutures in the skull? Definitely yes. Sagittal suture is an example of serrate suture. So, question is, what kinds of joints are these sutures? What kind of joint is this? It's a fibrous type of joint. Are there any more sutures in the body, in the skull? Yes, there are many more sutures classified as plain sutures, squamous suture, denticulate suture, shindilasis. Okay. Again, it's beyond the purview of this class for me to teach you these things, but my advice is read upon them when you're studying the Norma Verticalis. In the Viva, it's very likely that they will ask you about what are the other types of sutures. Okay. And you should of course know examples of each. Let's now go to the next suture, which is the sagittal suture. Here is the sagittal suture, which is another serrate type of suture. Now what you're seeing is the lambdoid suture. Understand that? Pay attention everyone. So this was Norma Verticalis, right? Now only thing I've done is I've just tilted it a little bit for you to be able to see the lambdoid suture a little better. Okay, so here is your lambdoid suture. Best seen when you turn the skull a little bit. I advise you to do the same. Okay, so this is your lambdoid suture. Classify the lambdoid suture. It's classified as a denticulate type of suture. What is denticulate suture? It's when the articulating bones have edges like the shape, tooth-like edges which fit into each other. Use the diagram for further understanding. So we've seen three sutures, right? Coronal suture, sagittal suture, lambdoid suture. Sometimes skulls show an additional suture called as the metopic suture, seen in 6% of the individuals. Now look at this diagram. Can you see that there is a separate bone getting formed here? This is called as a sutural bone. What happens is a separate ossification center sometimes appears at some point and a bone develops around it. So suddenly you have a separate bone here between your parietal bone in the front and the occipital bone behind. Okay. Significance of both these information is that they are not normally present. So what happens? You may mistake this as a fracture. So you should be aware that these things are naturally happening in our skull. I'll now take you to something called as fontanelles, which needs us to go back in time. We are going back to the development of the skull. Okay, have some patience. This is very interesting. Okay, so what are you seeing here? You are seeing the little fetal skull. Okay, it is developing in bits. Can you see how it's developing in bits? Ossification centers have appeared in the membrane. In the center of each bone, frontal bone, parietal bone, you can see ossification centers appearing here. And the ossification is now radiating out towards the points where they are articulating, like the spokes of a wheel. Okay. So, and the bits that remain where the ossification has not appeared remain as membranous parts of the fetal skull, which are called as fontanelles. So, what is a fontanelle? It's a membrane-filled gap present on the skull at birth. How many fontanelles are formed? Okay, I'll point out the fontanelles for you. The red lines are the two fontanelles you need to know. Let me explain this a little better. These are the two membranous parietal bones, okay? In the center of which ossification center has appeared. It starts to grow outwards like the spokes of a wheel, slowly widening its circle of ossification, till the two meet each other at the edges. Can you see that the angles of the quadrangular parietal bone remain unossified? These are membranous bones, membranous fontanelles, anteriorly called anterior fontanelle, posteriorly called posterior fontanelle, and at the lateral corners called as anterolateral and posterolateral fontanelles. I want you to now count how many fontanelles are formed. 6 fontanelles are thus formed. Let's come back to a diagram which you can relate to. Okay, now come back and see that here is your anterior fontanelle and posterior fontanelle. Here are your anterolateral and posterolateral fontanelles formed on right and left side. Total number of fontanelles formed 6. Okay. Now question is, why are we studying all this, madam? Again, why are you teaching us all this? There is a reason. Fontanelles have a huge purpose. Okay. Let's take a look at what are their uses to us. 1. Age of ossification. See, most of the fontanelles will ossify around 3 to 4 months. There will be the anterior fontanelle which ossifies at 18 months to almost 2 years. Okay, we know this as a fact. What is the use of this fact? See, when you have a child and you don't know the age of the child, you can feel the fontanelle. If the fontanelle is ossified, you know the child is above 1.5 years. And not ossified, you know child is less than 1.5 years. As a clinician, you are able to judge the age of the child. One more thing you can do is, you can use it for getting an understanding of child's vitamin D and calcium levels. Okay, so a mother comes to you with a 20-month-old child and unossified anterior fontanelle. What do you decipher from this? Child is 20 months, anterior fontanelle is unossified. What could be the cause? By 18 months, it should have ossified, isn't it? Either the mother is telling the child's age wrong, not likely. Then what is the next option? The next option is the child has vitamin D or calcium deficiency. See how smart you are. You didn't have to check the child's blood levels to know that child had a vitamin deficiency. Okay. So this is how again the fontanelle helps you. It helps you to tell the age of the child. It helps you to tell the vitamin D and calcium levels of the child. Let's go to the next way it helps us. It actually helps in the process of parturition. What is the meaning of the word molding? How does it help in parturition? Now that's very interesting, students. What happens is the skull bones are held together by membrane. So when the child is passing through the narrow birth canal, the bones gently overlap a little bit, slowly reducing the diameter of the skull, making it easy for the baby's head to pass through the very narrow vaginal canal or birth canal. Okay, so thus this process of overlapping or overriding of bones is called as molding. This also helps when the doctor is doing a pervaginal examination of the patient. It helps them to understand what is the position of the skull of the baby. Okay, right. So 3 helps. Let's go to the next one. You have a baby who's come to you with a depressed fontanelle. If the fontanelle is depressed, it indicates that child is dehydrated. You can have a child with a bulging tense fontanelle. What does this indicate? Yes, it indicates raised intracranial tension and something has to be quickly done about this child. Okay, some reason is causing the intracranial pressure to rise. Right, there are other uses of fontanelles. Let's see them. It's important, of course, in growth and expansion of the skull. Because of the membrane, slowly the skull expands to the beautiful large size that we have, isn't it? So it's crucial in growth and expansion of the skull. It can be used for an ultrasonographic examination because there's a membrane there. You can use an USG machine to examine. You can aspirate blood because right beneath the membrane there is superior sagittal sinus. You can use it for aspiration of blood. You can use it even for CSF tapping. You can use it for injecting drugs in the brain. See how many uses the anterior fontanelle has. Okay. Thus, we come to the end of our discussion on Norma Verticalis. Let's quickly revise what we have done. Okay. What we did was, we understood what was Norma Verticalis first. Then we spoke about what were the bones forming Norma Verticalis, what were the sutures seen. We discussed classification of sutures and then we talked about the features of the Norma Verticalis. What is Bregma? What is Lambda? What is vertex, external occipital protuberance? Parietal foramen, structures passing through it. Temporal lines, attachments. And then we came to development of the skull, wherein we discussed the concept of fontanelle, the membranous gap between bones. We enumerated types of fontanelles, discussed the age at which they get ossified and discussed their uses. Okay. With this, we end today's class, dear students. I hope you enjoyed yourself. This is a very simple class. Running through it once or twice should make you ready for Norma Verticalis for any kind of examination. Okay. You are of course free to ask me any doubts by putting them in the comment section. I'll do my best to get back to you as soon as possible. Right? So it was a pleasure taking this class for you. I hope you enjoyed it as much as I did. See you across the screen in some other video. Okay. Before that, one last line for you. Don't let your yesterday, dear students, take much of your today. If you haven't studied yesterday, doesn't mean you shouldn't do it today, regretting what you did yesterday. Believe in your today. Look forward in life. Okay. Thank you so much. Bye.